Hello, for this week's case analysis, we will be reviewing two letters addressed to the AAMFT Ethics Committee. Our group consists of myself, Amelia, Chrissia, Heather, Linnea, and Shay. The first letter is regarding a client's complaint of her therapist and accusations of ethical violations. The second letter is the therapist's response to those ethical violations. We will then be reviewing actual and potential ethical violations as well as the implications and complications. The first letter, addressed from the client to the Ethics Committee, states, Dear Ethics Committee, I am writing to lodge a complaint against one of your members, Mr. J.P. Clinician. My ex-husband and my entire family, including my two children, have seen Mr. Clinician off and on over the last 10 years. We have been very close to Mr. Clinician. In fact, we began seeing him before we married for premarital therapy, coming highly recommended by my sister-in-law, my ex-husband's sister. She and Mr. Clinician went to graduate school together and are still very close friends. We took an immediate liking to Mr. Clinician and were appreciative of the referral as we live in a major metropolitan area and didn't know any therapists here. He helped my former husband and me develop better communication skills before and after we were married. He even helped one of my children who had been suffering from a facial tic shortly after he entered the first grade. In addition to family therapy training, Mr. Clinician had also been trained in behavioral therapy techniques and his intervention worked. So needless to say, we loved Mr. Clinician. He was our family therapist. In fact, following his successful treatment of our son's facial tic problem, we decided to give him an antique, engraved brass letter opener dating back to the Civil War, which had belonged to my great-grandfather. Knowing how much he loved antiques, we gave it to him as a gift. He loved it, thanked us, and put it in his office. Several years later, my husband and I began to have a difficult time. We decided to call Mr. Clinician again since we had had such success with him before. The therapy this time around did not go so well. I felt as though Mr. Clinician sided more with my husband and did not understand my point of view at all. The divorce got ugly. My ex-husband wanted full custody of our children, as did I, and our court battle began. During this process, my husband asked that Mr. Clinician evaluate both of our children, ages 10 and 12, for the custody hearing, which he did against my protestations. I told him that I thought he had to have a written waiver from me to do this. He said that he didn't need a waiver to offer his expert advice regarding custody. During the hearing, he used information about me that I felt he had obtained during the therapy. The court eventually awarded us joint custody, and I found this to be a very difficult situation. Since the decision of the court, I have been very upset about how Mr. Clinician conducted himself professionally. I also have regretted giving him the antique letter opener that I had told him had been treasured in my family for several generations. So I decided to take a look at AAMFT's Code of Ethics online and discovered that Mr. Clinician had violated several of your profession's principles. I think your member has acted very unprofessionally and unethically. Thank you for your attention to this matter. Sincerely, Ms. N.L. Client.
Thank you, Amelia, for reading the letter and also that great introduction. After reading the complaint letter, our group found that there were potential ethical concerns brought up by the patient. One of them was the conflict of interest in the multiple relationships. As she stated, the client's sister-in-law and the therapist went to grad school together. Another one is the gift. The family gave the therapist the letter opener. So this is also another potential ethical concern. Informed consent and written authorization to release the client's information as well was a ethical dilemma we found because the client didn't give informed consent to the therapist to evaluate her children. They also stated that the therapist shared information from their sessions in court. Which brings us to another potential ethical issue, which is testimony in legal proceedings and avoiding conflicts. As therapists, we do need to clarify the roles and the extent of confidentiality that it plays in the legal system. For example, confidentiality may apply to a therapy session. However, it may be waived if it's in a legal proceeding or we are forced to testify. With the legal proceedings, we also felt that there should be a separation from the evaluation of therapy. The therapist should have avoided any conflict of interest between the husband and given his own opinion regarding of who's more suited for having custody of the children. And it brings us to my last point of professional opinion. Sometimes is out of scope for us to have those opinions in a legal proceeding, especially if we have to determine where a child is best suited or what is in the best interest of the child. Often when there are these cases in these legal proceedings, there is a third party therapist or a third party evaluator. That is their sole job, is to make sure that they have the best interest of the children, and they are a third party that will have evaluations in both homes. So in this case, we felt that this was a potential ethical violation. Now, on the next two slides, my two group mates, Heather and Linnea, will go over what the actual ethical violations were according to the ethics.
My name is Heather, and I will be discussing part of the therapist's reply. The therapist replied with a letter to the ethics committee denying any charge of ethical violations. As a team, we identified a number of codes we wanted to discuss, and I will talk about 5 of them. The first 2 are related to one another, one being Code 1.2, Informed Consent, and the second being Code 2.2, Written Authorization to Release Client Information. In this case, the father went to the therapist, and the therapist allowed a conversation to happen without the mother, where they discussed who would be a more suitable parent to have custody of the children. In this case, there might be an argument that the mother should have been able to give consent to have this evaluation, albeit informal, done with a therapist. And perhaps written authorization to release that client information should have been mandated. The next 2 codes I'll discuss are in relation to the fact that the therapist was friends with sister-in-law of the couple. Code 1.3 is called multiple relationships, and it says that therapists should make every effort to avoid conditions and multiple relationships with clients that could impair professional judgment or increase the risk of exploitation. And it specifically calls out clients' immediate family members. Code 3.4 is called conflict of interest. We believe that the therapist could have and should have referred the family to another therapist, given they lived in a well-populated area. Even if he didn't feel like he would have been biased, he potentially could have been, and it could have impaired his work performance or clinical judgment in relation to conflict of interest. And the final code that I'll discuss is 3.9, gifts. So with gifts, there's some gray area. Therapists are to attend to cultural norms when considering whether to accept gifts or give gifts to clients, and should consider the potential effects of receiving or giving them. In this case, we decided that it wasn't a cultural norm for the therapist to have accepted this gift, and we all agreed that he should not have accepted the gift in the first place.
While evaluating the case analysis for the client complaint letter and therapist response letter, my group and I found many AAMFT code violations, as well as some potential ethical violations. The first code of ethics I'll be addressing that was violated was Code 7.2, Testimony and Legal Proceedings. The therapist response letter, the therapist gave their opinion on which parent they felt would be best for the children to be with. This was based on a biased opinion requested by the husband for their therapist to perform an evaluation on the children without proper written consent from both parents. This violates the code by providing misleading opinions that was based on an inappropriately acquired data, which was the evaluation of the children. The next code that was a potential violation, according to the therapist's response letter, is Code 7.5, Avoiding Conflicts. The therapist explained that he did in fact give an unofficial evaluation of the children per the father's request. The mother was not informed of the evaluation. And because the children are minors, a written waiver of consent should have been obtained first from both parents to complete any evaluation on the children. Since the therapist was called to testify, it is possible that this written consent can be waived for legal proceedings benefits. The next area of the therapist's response letter in question is Code 7.7, which is separation of custody evaluation from therapy. The therapist should not have allowed his own opinion regarding who was more suited for the children's custody to be given without ultimately obtaining the proper consent from the evaluation and therapy sessions regarding the minor children. Again, the therapist was involved in a conflict of interest when he gave his personal opinion for the father's benefit in court, since no waiver was signed by the mother beforehand. Finally, according to the AAMFT Code 7.8, professional opinions, the family therapist should not have given forensic evaluation for the custody proceeding. The therapist should have notified the court of the pre-existing relationship between the family's therapist and that it was a conflict of interest. A referral should have been made to an impartial therapist to have the forensic evaluation given. This would be the best to ensure that unintentional biases are incapable of affecting the outcome of the forensic evaluation and the decision regarding the custody of the children.
Hi, my name is Shay, and I'll be talking about some of the implications and complications of violating the AAMFT Code of Ethics. The implications and complications of violating the AAMFT Code of Ethics are significant as they impact both clients and therapists alike. Ethical violations can lead to a breakdown in trust between the therapist and the client, which is fundamental to effective therapy. AAMFT codes serve as a foundational framework that guides ethical decision-making among MFTs. Violations can result in significant professional repercussions, including loss of licensure, legal action, or damage to one's reputation. Dual relationships occur when a therapist has more than one relationship with a client, which can manifest either concurrently or sequentially to a therapeutic relationship. So in this case, there is an implication of dual relationships because the therapist knew the husband's sister. They went to grad school together and they keep in contact. So that is an immediate family member. So this situation eventually posed an ethical dilemma, which may have compromised the therapist's objectivity and effectiveness. Dual relationships can undermine a therapist's ability to provide unbiased care. The AAMFT emphasizes that multiple roles should be avoided if they risk exploitation or harm to the client. And although all dual relationships do not create a conflict of interest, the therapist has a professional responsibility to recognize potential conflicts, establish clear boundaries, and foster an environment of trust and safety. Informed consent. Patients may have different understandings and perceptions of informed consent, so the therapist must be aware of all of the legal limits of confidentiality, and clients need to understand the process, as it is essential to ensuring that the client can make knowledgeable decisions regarding their treatment while also safeguarding their autonomy. And the complexities that arise in balancing the need for transparency within ethical obligations are needed to maintain confidentiality, especially when sensitive information is involved. When therapists accept gifts, they may inadvertently alter the dynamics of the therapeutic relationship. So this alteration could lead clients to expect preferential treatment or manipulate therapist response. So in this case, we have a client who felt like the therapist was being more favorable to her husband, who was a friend of the sister, right? So in this particular case, when there is an issue of accepting a gift, it's best to err on the side of caution, and unless there is a cultural norm or concept for accepting a gift, it's just best not to in the therapist's case. And in the implications of custody evaluations, those extend beyond mere assessment. So Custody evaluations can significantly influence custody decisions and family dynamics. So it is essential that evaluations adhere rigorously to ethical guidelines to ensure objectivity and prioritize the child's welfare throughout the evaluation process. In this particular case, although the client or the therapist, offered just his opinion on which parent would be better fit, the husband took that information to his lawyer, and as a consequence, the therapist was subpoenaed and had to release the wife's information. Okay, so ultimately, adhering to the AAMFT code is critical not only for individual practitioners, but also for maintaining public trust in mental health services. Violating these ethical standards may lead to systemic issues within therapy practices if left unchecked. Ongoing education about ethics and regular consultation with professional bodies are essential strategies for mitigating the risks that are associated with potential violations.